Hello, I'm Paul Glasziou from the Institute for Evidence-Based Healthcare at Bond University. I want to spend about 10 minutes discussing some important concepts about the need to reduce waste in research and how that can increase its value. I'm going to focus first on the waste to understand its nature and causes, but then use that to look at how we might improve the value of the research we do. Let's begin with an example. The graph you see here is from a recent study on the effects of flaxseed in 27 men with cardiovascular risk factors. The researchers took blood at baseline, the initial point. Then they allocated subjects to either the flaxseed or rice as the control, and then took blood again at the final point, which was at 42 days. And what would you conclude from looking at the graph here about the impact of flax? Well, what the authors concluded was that the levels of CRP, the C-reactive protein shown here, and TNF-alpha were reduced only in the flaxseed group because they reached an erroneous conclusion by looking at the comparison between the initial and final in the two groups separately. But in fact, the rice was the control group, and if you look at that, it's got at least the same change. And so a correct analysis of that would have been to compare the green two sections, rice and flax before and rice and flax after, rather than the initial and final in the two groups. But this is a common error, and it leads to a lot of research effort to arrive at an incorrect conclusion. So, two British statisticians, Martin Bland and Douglas Altman, have tried to educate people about this for years, and the example that we were just looking at is taken from this paper on testing for treatment effects in randomized trials by separate analysis of changes from baseline in each group is a misleading approach. Doug Altman was a statistician in Oxford who spent much of his career trying to improve the quality of research, particularly its analysis and reporting. And he was troubled by the simple but fatal flaws that he saw that wasted all of a researcher's effort and good intentions, and that led to the research becoming not just useless but often misleading. So a brief history of that and of research waste. Out of his frustration, in 1994 he wrote a now famous editorial in the British Medical Journal entitled "The Scandal of Poor Medical Research," in which he said huge sums of money are spent annually on research that is seriously flawed through the use of inappropriate designs, unrepresentative samples, small samples, incorrect methods of analysis, and faulty interpretation. So we were just looking at one example of the incorrect methods of analysis, but all of these problems occur and are quite prolific in medical research, and in fact, indeed, all research. A brief history then. We, in 2009, Ian Chalmers and I tried to quantify Doug Altman's huge sums of money, and we estimated that about 85% of research is avoidably wasted through the sorts of problems that Doug Altman was talking about, and this represented about $100 billion wasted per year. Glenn Begley and Ellis produced a famous paper in Nature where they tried to reproduce findings from 53 research papers in the top tier journals Science, Cell and Nature, but could only replicate the findings of 6 of those. This so-called Begley's bombshell had a huge impact then on what people considered to be needed to improve the reproducibility of research in particularly basic sciences. In 2014, we published a 5-part series that elaborated on that 2009 paper on adding value and avoiding waste, and I'll have a look at an example of that in the moment. And all of these papers has led to an interest, particularly by research funders, in trying to do something about this problem. And so in 2014, the Ensuring Value in Research Funders Forum was initiated that now has over 40 funders who meet a couple of times a year to address the issues raised in these papers. and the NHMRC is now part of that process as well. So let's just come to that 85%. In that series, we looked at 5 different stages that you can see on the right here. And that's the questions being asked, the appropriateness of the design, conduct and analysis, the efficient regulation and delivery of that research, whether there was an accessible full research report that gave all of the results, and then the final stage was whether that report was unbiased and usable by others to be able to replicate the research, either for new research or for clinical use. We could estimate from the 2nd, 4th and 5th stages of this the degree of waste. We couldn't do it for the other 2. And for the avoidable design flaws, that was about 50%, non-publication 50%, and unusable reports about 50%. And if you put those together, it roughly comes to an 85% waste and that global total of over $100 billion a year. And if you want to see the details of it, the calculation, it's in this blog. So I'd like to look at just 2 of the stages to give you an example to illustrate what sorts of problems people run into at these stages. So let's first look at that 2nd stage of avoidable design flaws. Newton famously in a 1675 letter said, "If I have seen further, it is by standing on the shoulders of giants." So Newton was echoing the concept here of using previous research when you conduct new research, because research proceeds by building on what we already know. Sadly, we often don't do that in a systematic way. Let's have a look at one example of that. There was a trial of early nibodipine use in stroke, the Venus trial, conducted by Janneke Horn and her colleagues in the Netherlands. And they randomised over 400 patients to this, half to the nibodipine, half to the placebo group. And at the end of this, they found no effect of the nibodipine on reducing the impact of stroke. They were clever enough, though, to look at all the calcium antagonist trials. They found 28 trials that included over 7,000 patients, and when they put them together, as seen in the forest plot on the left-hand side here, they found no effect on either poor outcomes or on death at the end of the follow-up period. So that puzzled Janneke Horn and colleagues. They said, why did people conduct all of these trials? There must have been reasonably strong animal study research that suggested this was a good thing to do. So they conducted a systematic review on the animal studies, and they found 20 studies, and the review did not show convincing evidence to substantiate the decision to perform the trials with nibodipine in large numbers of patients. So sadly, this was all the wrong way around, and that's what Janneke Horn was trying to point out, that we should have systematically reviewed the animal studies, decided from that whether we should proceed with the first trial, and then accumulated the evidence as we went for each of those trials, a so-called living systematic review. So the sad thing out of this is that there's a lot of research effort that's gone in here in both animal and human trials with no progress in care. So it makes me think of this sign: thank you for not doing research that has already been done. And this sign should probably be up in every research institution around the world. But next to that sign, we should have a sign that gives us the directions to the clinical librarian, because we need not just the advice to look at the previous research, but we also need help in doing that well. The other easily quantifiable thing is the rates of non-publication. This has been done particularly for clinical trials, because clinical trials have now been registered for so long, and we can tell from the registration process what proportion aren't published. So this is one of the many studies that have been done, but it's very interesting, a piece of work by Jonathan Ross, because it looks at the breakdown by country, which shows there isn't much of a difference in the rates, by sample size, by study phase, and by whether it's non-government, non-industry, government or industry. And there's a bit of variation, but mostly we see it's pretty similar. There's an overall rate of just under 50% of studies being published within 7 years of them completing the research. So people worry about this non-publication because of publication bias. That's important, but even if it was unbiased, that's simply a waste that half the research, half the trials never actually get published. So that's a lot of research effort for half the potential output that we could be getting. So all of this research waste may sound a little bit depressing, but we should also think of it as a huge opportunity. That is, for all the effort that we already put in, we could be getting so much more out of it in our research system. And that's true for the individual researcher, for a research organisation, or for a country. If we worked on how our research systems and processes at a personal, organisational and country level could work a little better, we could publish all the unpublished studies, we could train people in good research practices, we could do rapid systematic reviews before we do new research, we could reduce some of the inefficiencies and overheads in conducting research, and we could build the infrastructure necessary for good research quality. So let's have a little look at how part of that system might look. And that's by thinking of this triangle here of the users of research, participants in research, and leaders in research. And we should think that all healthcare professionals should move up these steps. They should all need to be trained as users of research. That is, in the basic skills of using research by asking good clinical questions. That's the so-called PICO. Being able to find all the studies, efficient searching, and being able to tell good studies from poor studies and understanding their limitations by skills in study appraisal. After they've done that, some people may want to become participants in research. That is a sort of an apprenticeship program experiencing the conduct of research in the protocols, ethics, blinding, measurement schedules, etc. And some of those participants in their apprenticeship may eventually go on to be leaders in research, conducting their own research designs and leading research projects. So I hope that's given you some food for thought on how we might reduce the waste in research, but also see it as an opportunity to improve the value of all of the research that we are involved in. Thank you.